Bow our heads. Lord Heavenly Father, we just come to you now, thanking you for this opportunity to serve you in a way, a civic way, Lord, that we may be the commissioners that you would want us to be, Lord. We would lead this county. Thank you for everyone that's here and their interest, Lord. I ask you just give us wisdom, give us civility, that we will approach it in the right, respectful manner, Lord. And as we go, Lord, just open our minds to what you would want us to see that would better our citizens and the people of Fannin County. We ask these things in Christ's holy name. Amen.
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 Commissioner Church, you want to lead us in the pledge?
Yes, sir. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Thank you.
Thank you. Well, let's look close, man. You can hear it. I think everybody else has issues too, right, Mark? There's a lot of people that has issues. So we brought you here today to for presentation by the brokers for our insurance, and we've talked to you all in and about for the last little bit, and get some information, sent out what we needed, and sent y'all some information and so forth and so on. So, but we'd like to ask Jesse Hall, who is our human resource director, to come up and maybe give a little more explanation of why we're doing it this way.
Good afternoon. Like Jamie said, my name is Jessie Hall. So I have worked with some of y'all, and then some of you I haven't really got to meet yet. So I know we've kind of emailed back and forth just to get some information. So the reason we are doing this is because in a meeting with our current brokers, we were told that it didn't matter who our broker was, that anybody could get a quote, say from Anthem, Blue Cross Blue Shield, that whoever went to them as a broker to get that quote, that everybody would be given the same quote. So we decided that instead of shopping for insurance, we would shop for brokers, and that's the way we would handle our insurance this year. So that is why we sent out the RFQs, the request for qualifications, to see what a broker could do for us as Fannin County employees. So in the RFQ, we asked for their qualifications, what some of their commissions would be, who they were currently working with, and what some of the benefits of working with them would be. And then we set a deadline for April the 21st, and we received 3 RFQs by the 21st. We were contacted by other brokers that they did not either get the RFQs to us on time, or they never sent an RFQ in. So we did receive the 3 RFQs from the brokers that we have here today, Matt Bidwell, Ron and Cindy, and Kevin Painter Insurance. So that's who we have with us today.
Jesse, what's RS?
RFQ,
Yeah.
request for qualifications.
Gotcha. Thank you.
And also I sent out an email to our current Fannin County employees asking them what was some things that they were looking for in insurance. What was some of the good and bad from past years all the way up to today. And also with the people that helped our brokers sign them up for insurance. You know, what did they like about past brokers up to what we have today. So I got several emails from different employees, and I have compiled some questions up from those emails that I received also, so I gave everybody a copy of those. Would you like me to go ahead and go into the questions?
Be fine.
Okay. We're asking questions.
Johnny, can you hear good enough? Johnny?
Yes, sir. I'd like to hear some of those questions, though.
Okay. Come on.
So, one of the questions that I wanted to ask the brokers was, will the employees be able to have their spouse partner on their insurance coverage if their spouse partner also can have coverage at their place of employment? So I know the coverage that we have this year, employees were not able to have their spouses or partners on their coverage if their spouse or partner could have coverage at their place of employment now. So I wanted to ask each broker, is that something that we can do this year?
We want to do that now?
What was the answer?
We don't have any, we're
We
fixing
don't.
to ask.
Oh, I thought you said the answer.
Well, let me ask y'all a question to the brokers. Would you rather go through these one at a time and then come up and give a presentation? Or would you rather have the presentation and then ask these questions? I mean, what would be best for y'all?
Chairman,
Whatever's easier for
I'd like
y'all.
to have one, I'd like to have one at a time so I can compare them. I can compare all three, because
Okay.
we do it, if they go through all of them, like I said, I'm a little slow, so I can't remember 1 from 9.
Gotcha.
So I'd say we do 1 altogether and 2 altogether.
Okay. Is that all right with y'all?
I'll leave a copy of the questions up here for you
Okay.
also.
And it's the incumbents, are we
Sure.
first?
Yeah.
I think I can answer that, pretty much all of us. That decision was made by the county to exclude those dependents if they had access to coverage somewhere else. That was not something that the insurance company nor the brokers made. Again, I think we've spoken to you in meetings that there was a lot of things that the former administration wanted to do. Some of them we agreed with, some of them we did not. And of course, you know, we're gonna do whatever you guys tell us, unless it's something that's totally wrong. And if it's totally wrong, then we're gonna tell you that we can't or won't do it. But that was a decision that was made by the commissioners, not by us. In any program you go with, regardless of what carrier or what agent, they can add those people back, they can remove the smoking portion of it, they can do all that if that is something that commissioners want to do. Excuse me.
Okay.
Okay?
All right.
Thank you.
Thank you.
Did you hear his answer to that one, Commissioner Searcy?
Not really good, but who is he with? Or is he just, we use him now?
Yes, they're
United
the ones that we're using now with United Healthcare. And his answer was that was a decision that was made by the previous administration.
Okay, when you say the answer to the question, that's the question of the tobacco use?
No, that spouse being on their, the employee's plan, even if they have an access to coverage through their place of employment also.
Okay, thank you, ma'am.
That was also, with the smoking, it was made by the commissioners, not by the insurance
Okay.
agents.
Yeah, Cindy just said the one regarding the smoking, the tobacco discount was the one, that was also made by the previous administration.
Wasn't there 1 more?
Okay,
Didn't
thank
we
you.
have 3? Or was it just 2? It's like there's 1 more.
Smoking. Was that
Spousal
what it
carve
said?
out.
Smoking and the
Smoking.
spousal
That was
carve
just
out.
those 2 to carve out.
And then, of course, there was a charge that was voted on for the smokers.
It's a penalty.
That was $50, isn't that correct?
Yes.
Correct.
Okay.
Commissioner Searcy, good to see you. Good to see you. Yeah, just speaking, just trying to keep it nice, sweet. That's correct. You know, the previous administration, as with when we previously had it as well, y'all can make those decisions yourself, how rich you want the plan or how lean you want the plan. You know, it's totally up to y'all, tax base, what the county wants to fund. And just like I said, we're the same way. We will do whatever y'all ask to do with it, as long as it's legal. We'll give you the best advice, and even previous, we give some advice to make some changes that they chose not to, that had some cost factors and stuff to it. But this is Fannin County's plan. You can decide how rich you want it, and it's according to the budget for that. Is that answer clear on that, Commissioner Searcy? I want to call you Chief Searcy too, so I'll call you both.
He's still cheap.
Yeah, Johnny Two Hats.
Johnny Two Hats, that's right. All right.
Yeah, I appreciate that, Kevin.
Yes. And the same way the smoker question, that, and every plan can be different from that standpoint.
Kevin, let me ask you this. Are we gonna get, usually when you get plans, you get a regular plan or maybe in a premium, like you say, a richer plan, a better.
You can.
So we're still gonna be getting something like that from.
If that's what you choose to do, and any of these three brokers set here can certainly give you that
It's
option.
not so much what I choose to do, it's what I want the employees to have the flexibility
Sure.
of choosing.
Yes.
You know, one of, maybe somebody is really worried about the price
Yeah.
and could lower it down there, or.
And that's
maybe
the best way to do it.
More
You-
coverage.
You know, in our opinion, that would be the best way. You're gonna give your employees option, because they're,
Options,
you can make that plan as rich and say, look, if you wanna pay a higher premium, you know, this is what the county's willing to do within our budget. We can do this amount. This plan, we're gonna make it richer, you're gonna be paying more, you know, however they choose to do it, payroll deducted from that standpoint. But it is good to give people options, because as large as Fannin County's got now, it's hard to have a one plan fits all.
Fits all.
Exactly.
Okay.
You know, back in the day, we were a small county, but now, with healthcare, some people may choose to want to stay local, and that benefit, you know, just can be designed for that, or if they want to go out. So it's totally up what y'all as commission chooses to have in your plan. We will handle the legal side and give you the legal advice, what can and can't happen from a regulatory standpoint, but benefit design, how rich or how lean you want it, is up to y'all. That good?
Well, let me ask you a question, Kevin. People with pre-existing conditions, now if we decided to, say, change and go with something different, how is this gonna affect people that has to have their medication and stuff if they've got pre-existing conditions?
Yeah. Johnny, that's federal law that will pertain to that with those pre-existing. We're gonna be taking over the whole group with those pre-existing conditions. So there wouldn't be anybody left behind from that standpoint. So that will not be a factor of any of the brokers from that standpoint. Because
So
federal,
you can actually promise me that, all these people that have these conditions, they're not gonna be able, I mean, they will be able to stay on track with their medications and stuff?
absolutely, absolutely.
Oh, thank you.
Yep.
Kevin, you may want to point out that, you know, when you go from one plan to another,
Sure.
that they've got different formularies.
Yeah, there is, like I said, there is different formularies in the drug plans. You can select, for instance, there may be a very popular drug that someone may use that, you can choose that and add that into a tier 1 drug that could have a lower copay. You could put it into a tier 2, and that affects pricing. So in your drug formularies, you can pick, you know, which medications you want, and that does affect, you know, the premium from that standpoint. So certainly, that's what you really
And
How's
do.
it
there are
gonna
some
affect
drugs
any
that
kind
aren't
of-
covered at all.
Yeah,
There
Yeah,
are
they're
some that
experimental.
just aren't covered at all.
exactly. I'm sorry, Johnny, you
How's
want?
it- What about generic type medications? If they're not taking this generic type and they're on a certain type of medication, are they gonna be forced to change, or can they stay with the thing that works with them?
They can stay with this thing that works with them. You know, and also if the company tries, and this is with if the company tries to get them to go to a generic, they can appeal. There's an appeals process with every company out there in order to do
Okay.
that.
Thank you, guys.
Yep, thank you.
I'll speak into the mic for those who can't hear well, and that's me. Commissioner Searcy, I'm glad you're doing well. Look forward next time you can be here with us.
Thank you, sir.
Absolutely. Thank you all for having me here, and
Thank you, man.
Commissioner Hensley, appreciate y'all having us here. When I saw your sign, I thought you were a blonde. It was really pretty, but anyway. Will the employees have a spouse? Will they, you know, can they, y'all exclude them from coverage? Well, sure, you can legally do that. What we normally do, we have about 40 other counties we handle benefits for, and probably on about 25% of them, they don't exclude the spouse from coverage, but usually the intent behind that is to try to offer low-cost coverage to the employees, and at the same point in time, try to control our cost on the county end. And so typically the way you do that, and you do it in a flexible way, is we put in what we call a working spouse rule. And the rule, what I want, usually what our counties want to do, is we want to provide coverage to the employee and their spouse. And if their spouse is a beautician, construction, they work in a restaurant, industries that typically don't offer insurance for the spouses, they want those spouses to be able to come on, and you've got to keep that payroll deduction at a level that they can afford. So typically what they put in is a working spouse rule, and we ask the employee a couple of questions. One, is your spouse employed somewhere? They answer yes, that's okay. The second thing is we ask, does your spouse's employer offer coverage where they work? And if they answer yes, the next question is, are you putting your spouse on coverage with Fannin County? If they answer yes to that, then when they go to look at the cost to add the insurance on, whatever the county decides is an appropriate fee to cover that spouse, it's actually loaded into the payroll deduction. So what we're doing is, as a county, you're wanting to cover those employee spouses who really have no other options. But on the same token, if my spouse works for the school system and they have pretty good coverage over there, but they look over here and say, hey, the county's coverage is better, we're going to come over here, that's a way of actually persuading them not to join your plan, but at the same token, you're not hurting those employees who actually really need the coverage because their spouse doesn't have coverage available to them. So typically, before we would exclude a spouse, we would recommend that you put in a working spouse rule and then put in there, and generally about $100 a month, you know, or we pay bi-weekly, twice, weekly. Usually it's about, it would be about $20 a week on family coverage. And that puts it back to a more level playing field. And that way you've allowed those spouse, you know, if I want to put my spouse on and pay the additional money, they got coverage where they work, let them come on. But again, you're not harming, you're not doing any harm to those people who really don't have any other choices. And that's typically what we would recommend. In terms of the tobacco rule, that's a hot topic because, you're either a smoker, you're not a smoker, you quit smoking. And when I go into my government, I think 90% of every public works department smokes. I think it's part of the criteria to go to work there. And the courthouse, nobody smokes. So, the rules are designed to encourage good behaviors, and I understand why they need to go in. I do try to avoid them and use other carrots to try to get people to quit smoking. But on the same token, sure, they can be put in there, but they usually hit the lowest paid employees among us, the ones who can least afford it. And then, unless you're actively testing, and a nicotine test costs about $40 for a saliva test, you get into the situation where somebody isn't being truthful with you, and you got half the department knows it, and the other half doesn't. And so I try to avoid the tobacco surcharge, and I try to use more of a carrot, something that's positive for the employee, and I try to make sure that there's positive programs out there to try to help them quit. But again, that's just a philosophy, and I think it's a little bit more friendly toward the employees.
Can you give some examples?
Well, like for example, if you're smoking, every insurance program out there, United Healthcare has a great one. I quit smoking.
Right.
You tell them they enroll in that, they quit smoking, we'll give you an extra half a day off. And see, you can give them rewards that don't technically, it doesn't have to be cash, but just give an employee a half a day off, or give them a day off, or put an incentive out there to do this. And you can put other incentives in there. You can give gift cards, but typically there was a Kaiser study several years ago, and the Kaiser study said that about 90% of employees look to their employer for wellness guidance. They really do. And that's because most of your health plans have these pretty intricate wellness plans that they really want to encourage employees to get well. And I think from the county standpoint, we know that higher claims, meet higher premiums next year, but we do want those employees to actually be engaged to where they're doing things that's good for their behavior. And I also know this, I'm an older guy, and I know going through my life, when I was in my 30s and early 40s, I was trying to get my kids raised and get them out of the house, and I didn't really care too much about wellness. I didn't care about the extra weight I had on me. But on the same token, at some point in time in every person's life, they are going to hit a level where they want to engage in being healthy. And it's not for me to determine when it is for that person, but we want to put the tools out there so that when they do, when they're ready, you can help them. And
then can we have some kind of a program to where the employee himself can actually see that everything he does, that as far as health, wellness, or wellness for your health, or just staying in the gym or whatever, can't they show or see that everything they do that's positive for them is the deduction in their insurance premiums?
you can absolutely set it up that way. It becomes a little bit more trickier doing it that way. But like, for example, the first start of any wellness program is you have to define where you're at. So you may sit there and say, okay, we're going to start a wellness program this year, and it's going to determine what your premiums are next year. It ain't fair to sit there and say, if you didn't do this last 12 months, we're going to ding you now. That gets people upset. So I'd like to see, do what?
But the thing about it is, we're giving them options to help them along the way, but also help them keep money in their pocket. I think that is the key goal. Also provide good coverage.
Right. The way I would incentivize it is that you have a number of different things that the insurance companies can track and tell you. They have health risk assessments out there. They can tell you if an employee got their annual physical. And those are really the two main things. One, you got to know if something's broken. And number two, you've got to go through there and are you eating right? Is your weight where it should be? And then if you're going to your family doctor, most of us, if we go in there and I've got high cholesterol, high blood pressure, my weight's really an issue, my liver enzymes, they're up, they're going to come in there and they're going to say, hey, I need you to come back and see me. We got to follow up and give you direction. And I think if you incentivize employees for doing things that are under the health plan that can be easily measured, and that way of doing it is by saying, if you don't get your annual exam before we renew next year, if you don't go online and take that health risk assessment, then your premiums are going to be higher. I mean, they're fairly, and that's, by the way, doesn't cost you anything. If you want to get into providing financial incentives, there's other things we can do to suggest. But basically, I think for most employees, particularly this last year, everybody's been under a lot of pressure with this COVID virus. The depression, mental angst is way up. And so I think, our standpoint is we want to offer a benefit package and give people positive messages on this is how you can reduce your premiums next year. This is how we can cover your spouse without, and keeping it as not a yes or a no. So that's how I would frame it. So I didn't mean the accent.
That's fine, thanks. So basically, answer number one is, yeah, you can.
Yeah,
You can do
that's
anything, you got the
right.
money.
And
You
I
actually
certainly,
already are.
I
So,
certainly apologize.
No, that's fine. I was looking at some of this stuff down here, and I think, like with the tiered packages, okay, obviously that can be, I feel it can be. You can tier anything that you want to, as long as you got the money. We can start out with a basic entry-level package. We can step it up to here, and we can step it up to here.
Right.
Whatever the county wanted to pay is what we can do. I think we're all in agreement on that, right?
Yes, sir.
Okay, all right.
Can we touch on the
Can I
current
follow up?
wellness plan and just kind of
Just
touch
briefly?
base for the new commissioner?
Sure.
Go ahead. Because I just want to make sure that he understands that we already have something like
I
that
understand,
in
yeah.
here.
And I have a question when you get done, so.
One of the things I just wanted to follow up on is that Fannin County already has these things in place. Of course, they can be changed. The spousal carve-out is for, does address working spouses. And it can be changed at any, at your open enrollment. But you already have a two-tier, and that is a traditional plan, and you have what's called a fusion or motion plan. Every single person gets a watch, a basic watch that they can keep up with their motion that is on that plan. Right now, you have 52 participants, and those that are participating in that plan, there is a, not a penalty, but a bonus for that in lesser premiums. The premiums right now are somewhere in the neighborhood of $50 cheaper per month, in the neighborhood of. By doing the motion plan, it's a very good plan. It needs some extra, and we spoke with you, Commissioner, about actually giving benefits versus penalties for things that y'all might want to put into the plan. And I think that's the way to go. Help fairs, actually give them bonuses, additional money off their premium, cash cards, whatever you'd like to do. I'm in total agreement, and you've already got those things in place now.
But one of the things that thing comes with that you may want to explain to the new commissioner is it comes with a built-in HRA. It's a different HRA than any HRA that we've ever had before, but what it does is as that employee participates in that motion plan, he also, Commissioner, money goes into an account for that employee. And when that employee goes to either a doctor's office or that a specialist, in particular, a specialist, or if he goes and gets prescription drugs, then money comes out of that HRA to pay these charges for that employee going to that doctor. And we've got, I've worked with several of the employees up here on that, is to make sure that they understand how it's working, because you got a lot of them that are really engaged in doing this. And it's working out, and it's gonna make the employees healthier as long as they use it. The biggest problem that we're finding is that the phone calls that we're getting in our office on this plan is the fact that a lot of them just do not understand it. It is a little difficult plan to understand, but I think as time goes by, it's gonna get better. We're gonna get more participation. You're gonna see more people involved in it, and you're gonna see a healthier group of people.
Well, how long has this program been going in the past? And again, I'm new, Commissioner Search is new. How long has this program been going?
It just started this past year. It started
in 2020.
July 1, 2020.
Okay. So we've been on it close to a year.
Yes, sir.
And how many employees are on that you're aware of?
52.
52 out of, what we have, close to 2.
Out of 176 covered, I believe.
Okay,
it
out of
is.
176
people.
Okay.
So
Is there a packet? Is there a?
Yes, there is.
And I'm, for lack of a better term, I use the KISS theory on everything. Everybody familiar with the KISS theory?
Yes, sir.
Keep it simple,
Keep
stupid.
it simple.
So I love for everybody to keep it simple, stupid to Jamie, because I'm that guy,
Well,
So,
There is an entire packet that
And-
is explained.
and when we talk about an entire pack, and I'm not saying this to be mean, but I've been here since January and I haven't seen anything. I haven't got a packet showing anything that I can do to be able to do that. And again, I don't have that.
well, you should have.
So,
I'm not sure why that didn't happen, but we email them.
Yeah, I would just say for a few
It-
bucks.
It
for
typically
kids,
goes to
I'm sure.
HR to be forwarded, and unfortunately, there's been mix-ups on the HR because of the prior moving out in January and you taking over.
It's
So-
on the portal downstairs, or it's
Okay.
on the computer downstairs to be sent out to new hires. Hopefully.
Transitions are not easy when.
This transition has definitely not been easy, I can guarantee you
I
that.
haven't received anything.
It's,
Can I ask a question?
yes, sir.
Started that program, there's 50 people that's enrolled in it, and we have 255 employees. That means there's 205 employees that that's not even participating in that might be able to bring the cost of the insurance down. Is that not true?
Yes, sir, except, understand that you only have 176 people
Or so.
participating in the medical plan through the county. The rest of them have coverage either through their spouses somewhere else or just choose not to take it at all. But
Okay, so that would be 175?
176.
Oh, okay, 170, so that still leaves us over 120 people.
Yes,
So,
sir.
I can't believe that the commissioners or whatever, if it was gonna make their insurance cheaper, didn't make this a mandatory plan for employees.
To be honest with you, that plan would not suit every employee.
And why,
Well, you've got some employees that, you've got some employees, sir, that just, they don't like change. And, you know, I guess you guys could make it mandatory. That wouldn't be something I would advise. I don't know how the other brokers
well, I
feel.
just wanted,
Yeah, but you got folks like me. I mean, I like person to person, and some other carriers like, some other brokers like to do online enrollments. I don't like that. I don't like that at all.
Well,
I like
well, I
to be able to.
understand that, sir, but what I'm trying to get at, if you work for me and I'm trying to keep money in your pocket, that's the thing that you're gonna like about me more than anything, ain't it?
Yes, sir. Keep those cards and cash coming.
Yeah.
But
I just wondered, I'm just asking questions about.
Yes, sir.
Let me ask you another question real quick and I'll shut up. What about this, tobacco use? How come it costs us employees $50 to use tobacco?
That's what the prior commissioner, set up, and
All right, then what was the purpose of that?
it was to hopefully encourage the employees to look into non-smoking, programs. And, you know, I'm not sure, I can't speak a whole lot about what the success of that was, because we changed carriers. It started actually 2 years ago, and we changed carriers last year. The prior carrier, Benefit Support, was keeping up with all that, and they were actually had in place a program that would pay 100% of that if they went to one of those non-smoking programs, as long as they
Okay.
showed participation. We tried to set it up where it would work out and that we could keep track of who was doing what. Again, it was kind of a really strange situation, and we as brokers got blamed for it, which is fine. I mean, we're used to that, but.
Hey, I know all about that.
Yes, sir, and I think if you read my resume, you found out I used to be with GBI too, so I'm used to that too.
Yeah.
so I have just a statement in general. So if the $50 was mandated for these smokers,
Uh-huh.
and this is what it is, and it's hearsay, and I just won't repeat what was said. But if that was mandated to smokers, and people didn't like it, but yet they paid it.
Right.
So I feel that this could have been mandated as well. In other words, to promote health.
It could.
So, yep, you're not gonna like it, but here it is.
No, you're not
Okay.
gonna like it.
So now that being said, let's get back to the $50. I'm just in my mind, I struggle with this for legality reasons.
Okay.
Because how in the world can you charge somebody who smokes cigarettes $50 or X amount, let's put X amount, but you can't charge somebody who drinks Cokes? Because we all know that Cokes are full of sugar and they're bad for you, and yeah, I drink my share and I probably shouldn't. And I know this wasn't your decision, but there again, as a broker, how could it be possible to charge somebody for one thing and not charge somebody for something else? You see what I'm saying?
You could certainly put whatever you want to.
Well,
in place.
I understand that, but,
Uh,
and this is gonna be for any of
The
you.
broker didn't charge them.
No.
And their
And I know
defense,
that.
it wasn't a broker.
I know, I understand that, but for any of you brokers, my question is, if it was wrong to do, and morally wrong to do, if you wanna put it that way, or legally wrong to do, could we not spoke up and said, hey, you can't do that? I would recommend highly that you don't do that.
We did.
You did do that?
We did.
Okay, okay.
And as a matter of fact, it was due to us that we bought 6 months for every employee
They
to
were-
attempt to before the penalty went into play.
And I
They're
can just,
going- I'm sorry.
I know I can tell you now that that $50 is still coming out of the check. There hasn't been one person, to my knowledge, because I still get hollered at about every other week, you know, when are you gonna do this and when are you gonna do that? So there hasn't been one person who has went to a rehab place as far as getting off smoking, so.
There actually has been a few that did quit smoking, and last year we found that out, and their penalty was removed. But not, just a handful, not very many, but there was a
Well,
few.
how do we know they actually quit smoking?
Well, that's what they attested to and signed out
Yeah.
on.
So now I can just get all the guys to attest to it and we're good to go. That's good. I like it.
That again is
I know,
something that's
I know.
Devin said.
I know it's not on you, I'm making statements.
Do you want to speak about that
So,
as far as the state was concerned? Because they were actually the first people that
As
I'm
far
aware
as
of,
the
unless
state-
you guys know something I don't, but we're the
Well,
first ones that
Our school,
actually
when I
put
was
that
with
in.
the school system for 31 years, they did do that about 10 years, I guess maybe even 15 years ago. And it had a twofold purpose. One, to help the employees' health. And two, to help cut costs.
Right. Yeah.
And those were the two factors involved. And like I said, as far as I know, the school system still has it.
They did.
They did, $80.
They did.
And I guess, you know, either you accept it or you don't as an individual. But, you know, they do with the chewing, it's not just smoking, it's chewing. And, you know, I know our chairman that there is a lot of things that's bad for us that we do. But I guess with cancer and all that, they feel like that, you know, they help that employee health-wise, you get a better employee.
Right.
And a longer longevity as well. You know, instead of the person getting cancer and not being able to work 20 years, maybe they'll get 30 years.
Yeah.
So that was the thing that we did.
I think what to answer your question, Mr. Jamie, is you can prove if someone's using tobacco because of a nicotine test. You can't prove if someone's drinking 6 Cokes a day. You know, I think that's right. I mean, you can tell, I guess, by looking at them after a while, but
Yeah.
you can't, you know, there's a test that can actually prove that. So that's probably, but now we do have groups, and this is a lot more.
What's you saying, Chick?
Sorry.
She's just saying, she's just pointing out the advantages
Be next,
of
sorry.
proving, you know, the proof of when someone's actually smoking the test versus drinking Coke.
I was just explaining, he had said, how can you do one and not the other? And I think, as all the brokers would agree, that when companies do that, it's because you can prove if someone's using tobacco, because they just have to do a blood test and is nicotine in your system or it's not. So, where you can't really prove if someone's eating French fries and drinking Cokes every day. I mean, you can after a while, but you can't like daily. There's not a test that you can take for that. Does that make sense? But I will.
Yeah,
Go
but
ahead.
what I'm getting at is that, obviously, all the commissioners, sure are in agreement that we want to provide the best insurance benefits to our employees that we can. That's why I think that yearly physicals, actually, when you go have blood work, that tells the truth about a lot of things that you're doing.
Correct.
So if your cholesterol or your sugar or whatever, we're gonna know. But there again, though, we're trying to make sure that it's something that our employees can afford
Correct.
and that they're happy with that they're getting.
Yes. Yes, sir.
I understand what,
You're correct. I was just trying to explain how that you could do one and not the other, because it's not just signing an attestation. You could actually prove if someone was lying or not, where you couldn't other. I mean, I'm not advocating either way.
No, I got you.
But I will say that when you did mention that, we do have, one of our big hospital systems, they are a lot more intricate in this, and this is actually more work on the HR to do this and their, wellness program, but they do it by BMI. You don't get charged if you're overweight, you get a reduction if you're not. So, and they do give you like a year from when you start or when they start the program, where you have that long to get your, it's your BMI, tobacco, what was the other? Just regular blood work. If it's in normal limits, that's what it is. If it's in normal limits, and you have a year, and if you don't get it within normal limits, then you don't get, you get the regular premium, you don't get the reduction. So you can do a lot of different things. That's where they said earlier, it's up to you. Yeah. It is better to say you get a reduction in premium if you're good than a penalty if you're bad. But
Look at it
it's
from
the
a positive
same. It's
aspect.
6 one way, half a dozen the
The
other.
positive's always better than the
Correct.
negative.
Yeah.
You know,
But I
slapping
think
your
the
hand.
nicotine thing, which
Yeah.
is all because they can test that. And then they can also test if someone says, I quit, okay, well then bring us the test showing you quit. So that's just the legality part of that.
I think, too, just real quickly, do what Mr. Matt said a minute ago. 90% of the employees feel like employers kind of help them with their health, their wellness.
Correct.
So if that's true, and also, you know, in the school system, you gotta look at the kids, you gotta look at the example you're setting.
Right.
You know, the days where we smoked in the boys' room, bathrooms, or, you know, around the corner is gone.
Gone,
It's
correct.
and it's not gonna come back. So,
And I will say the school system or the state merit system is, I think, the first that we saw too, that where they added the tobacco.
Yeah.
And they still have that. It's $80 a month per employee that uses any kind of tobacco.
right,
There was something else you just said a minute ago.
about the 90%, Mr. Bidwell said 90% employees feel like their employers
Correct,
help them with their wellness, and they look to their employer for guidance.
correct. Yeah, that's true.
Anyway,
This gentleman right here has had his hand up for a while.
Introduce yourself, Mark.
And I apologize, I can't show it.
Hey, my name is Marvin Jinks, and work with Ron and Cindy, and just glad to be here. So I think the delicate balance of a broker, right, is to take the goal and the wishes of the county, whatever their utmost goal is, right, and match that to a benefit plan that works for the employees. So I think when we're talking about this tobacco issue, I don't know if the major goal of the county was the health and the wellness of the employees as much as it is the cost and the long-term impact of what tobacco does. So when you start talking about major claims and things like that, yes, you have reinsurance that's going to take care of that and pay for that. But at the same time, if we ever need to shop your insurance and look for another carrier, then a person, you know, having multiple cancer claims within a group does affect that. So I think that's the other thing, if I hear correctly from you all, is saying, hey, we want to make sure we take care of our employees, right? The previous administration may have been saying, look, we want to do the most important thing we can do long-term for the county. So what we've got to do now with the new administration is marry those two things. The long-term cost incentive for the county might have been saying, look, we're going to encourage everybody not to smoke, right? We think that is the major thing that's going to drive claims and going to cause our claims to go through the roof. So that's where I think we've got to figure out what you guys want and what your utmost goal is versus what the previous administration said. Look, this is what we're going to do, and we're going to shove it down your throat whether you like it or not, right? So that's where we've got to figure out. So.
All right,
Thanks, sir.
So now that being said, and I know, you know, time is quickly getting past us, and it is. So, and commissioners, if y'all will, if you don't agree with this, let me know. So, once again, I think you guys know about how much our insurance is annually, correct? Everybody had the same paperwork sent to them, and we
I
understand
can
that.
give you the rates if you like.
Okay, and we'll probably get it here in a little bit, I'm sure we do have it, but, we're also looking at, and we were told there was gonna be a substantial increase, is that correct?
The first offer.
But they always, and these guys will agree, the first offer always out is a substantial increase.
So,
But
so
they
that,
got room to play.
that substantial increase, and when I'm busting out numbers, yeah, it's a substantial increase.
Yes, sir, it
Okay.
is. I agree.
And I think it was somewhere along the lines of 28%, is that
Yes,
correct?
Max,
Pardon me?
maximum, and
Max.
if the plan
And a
changes, they
minimum.
suggested around 17.
Okay, so that's even cheaper today than what I'd heard at 20.
No, it came in the
What
original renewal.
Chairman,
Yes, sir.
what did you say, what did she say the price was?
She said the max was 28 and the lowest could be as low as 17%.
With the plan changes that they're suggesting, that UHC is suggesting, but that's a starting point. It's always a starting point. It depends on negotiations between us and the companies, that meaning y'all, ourselves, and the company. Negotiations, which way you would like to go with certain things, we can always bring that premium way down.
Okay.
We have one that we just did that started out at 18, and right now they're at 4 after negotiations. So it really does depend on your agent.
So they went from 18 to 4%. That's what you're saying. So
Yes, on a different group that we just negotiated down.
So now that being said, and I know we'd all talked about this as well as far as broker's fees, the percentages. Okay. Can you tell me what your percentage is currently and what it possibly could go to?
Sure. Right now, and I sent you a copy of it, it's at 5.5. Honestly, like, I know nobody believes this, these guys don't either, but I don't pay a lot of attention to commissions because what we get from the company, we don't set. We just take their default commission on whatever the group is.
Okay.
And if I'm not mistaken, it's 5.28, and that does not include any ACA fees that's included in the cost of the plan. So from what I've been told by the people at United Healthcare, it's probably down around 4.78 is what the actual cost is. And we don't charge any addition. And what I had told you about in the meeting that we had about that all brokers can get the same rates as long as they provide the same information, as long as they provide the same health conditions. And then once it's over with, then everybody's going to get the same rate. It all depends on the agent that's negotiating the rate.
Since we're talking about rates, can you go ahead, Matt, and get your rates as well? Oh, your rates fee, Matt?
Are you talking about our fee?
Yes,
Your,
yes.
your broker fee.
Our fee
Commission.
to provide the services,
Yes.
is already relayed to the chairman, and it was 2.5.
Is that on top of commissions?
She asked if that was on top of commissions or is that the rate?
We take the base fee that the carrier says they need to provide the services, and whatever that is, we add 2.5% to that.
Do you know what their base fee would be?
Well, if you currently are at 5 point something, then it would be taking your current rate, reducing it to 5 point whatever percent, and then adding 2.5 on top of it. And mind you, well, in easy math, if the current rate is 5, we're going to 2.5, so it'd be half of what the current is. But also mind you that that is not just a fee that you're, a consulting fee you're paying me. If you were telling me that you just want me to do consulting, you don't want any services from me, I would charge you $2,000 a month. I charge you a flat rate. Right now, what the county has here, and I don't know if Johnny can hear me. Excuse me, I mean Commissioner Searson. Right now, when we look at you guys, you have one person in HR. Normally, a group will have one person in HR for every 100 employees. That's normally what we see. Sometimes it's 80. And so when I tell you we do a lot of government groups, it's because you all are very typical with most of the governments we deal with. There's just not a lot of help to get stuff done. And so part of our fee goes toward developing communication pieces that are of high quality. We have the printing equipment in our office so that when somebody enrolls, they know what all the literature is. They have information. It's communication. And we had the county's insurance out for about 1990 up until about 1999, I think we started working with the county, and we had your all's insurance up to about 2017 or so. And you never had a problem with the insurance out here because the employees always knew what their benefits were. They knew exactly what was coming out of their paycheck. They knew that if they called our office, a live person picked it up, the phone. They looked in the computer, and if it was somebody from the road department calling in, we didn't have to ask him his social security number, his date of birth, or his kids' names, because we had all that information on the screen. And they just had to tell us what the issue was, and we took care of it.
What you're talking about is customer service.
It's an old-fashioned thing.
Customer
And
service.
having a live operator pick up the phone, and you don't have to sit there saying, "Now tell me your name again, Glenn what?"
Gotcha.
You know, it's just common sense. And so that fee that you pay us, if you're, let's convert it into money. If your premiums are $1 million, that's $25,000. So on a $2.5 million account, we're talking about $75,000. That's not to just enrich me, even though I like the money, don't get me wrong. But that goes toward us buying the enrollment platform so that when an employee comes in and they enroll in their coverages, and we enroll their medical, their dental, their life, their vision, all their benefits. And it goes directly into the insurance company's file. There's no you all going online having to log anybody in. There's no, if an employee terminates, you having to go to 6 different bills trying to terminate them with each company. It's because electronically it's all done on our end. And that's why you can have one person in the HR department. I haven't gone through my presentation, but it has to do with, we spend more time communicating. We write all the open enrollment letters. We have you approve them. We're the ones who do all the mailings. We are the ones who print everything. We bring it to the employees. We sit down with them at a laptop and help them electronically enroll face to face. And if an employee is off shift and they prefer not to get up early or they don't want to come in, they can call into our office and somebody live will talk to them over the phone about their benefits. So it's really just about making sure they understand what's going on. And honestly, it's a self-serving proposition. If you do a good job up front, you don't get as many problems on the back end. You just do it right up front. And I want to just mention briefly, we talked a little bit about the wellness. One of the problems with tobacco issues is that under the Americans with Disability Act, which I know everybody loves the Americans with Disability Act, if an employee says they're addicted to tobacco, you all must have a program in place that accommodates them because it's an addiction. And that means you cannot surcharge them, but you have to have an alternate program set up for them. And I don't want to say I'll bet you as much as you'd like to bet that you all don't have an alternate program set up, but I bet you all don't have an alternate program set up. Whenever you have a performance-based wellness program, keep your weight a certain way, keep your cholesterol, keep your blood pressure in these parameters, you get a benefit. You have to have alternate programs to accommodate the Americans with Disability Act. On a group with one HR person, you're going to have to outsource that, and you're now talking significant dollars. And so you can do them, but you're talking significant dollars. That's why we say keep it positive, keep the carrot up front, unless you're wanting to get into spending money, then we can show you how to spend it. In terms of controlling costs, it's taking care of your chronic conditions. Diabetes, heart disease, asthma, COPD, those people have to be identified and they got to be helped along. The biggest problem that we try to help prevent is you get people getting in their 40s and they don't realize it. They think they're going to live forever, and they don't see their doctor. And men are the worst ones. Probably about less than 25% of your men are getting their physicals, and they're going to have high blood pressure, high sugar, high cholesterol. They screw up their cardiovascular systems, and then when they're in their mid-50s, then all the effects of it are coming through, and then you're trying to fix something that's already been really broke. So you're really trying to educate them, and I have found it very useful. I always say, if we want to give incentives away, you get your annual physical done, we'll give you a certificate your oil changed. They won't drive that truck 3,000 miles past oil, but they'll go and never check their own blood. And so we try to give them examples that they can relate to, and running your body through most of your 40s and not getting your blood work checked is like running a truck on about 10,000 miles and then thinking it's going to fix itself by changing the oil. Don't work that way.
Mr.
So,
Spader,
Commissioner Chairman,
come on up. I know you've been patiently waiting.
Give us your numbers.
we're just like these other brokers sitting here. We're going to be paid a commission by the carrier. Each individual carrier will be paying a commission. We're going to bring you plan selections of what you desire from that standpoint. Our fee, we're not charging any fee to Fannin County. Our commission is coming directly from the county, just like these are right here. Very short, sweet, and simple, okay? Nothing hidden. Thanks.
All right.
No fees.
So, short, sweet, and simple. Yours is 5.28 with a chance of going to 4.78, correct?
It's actually a chance of going even
Well,
lower.
that's where we're at. And yours is 2.5, and yours is whatever commission that yours gets. Yours is 2.5 on top of that,
On top of the 5%.
or it's just a,
Yeah, on top of
It's
5%.
below, no, it is below. If,
and
Insurance companies-
Just simple it out, just simple it out.
sure, insurance company is going to come in there and say, we need $2 million to cover the claims.
Okay,
How much compensation do you want to put on the broker?
2.5.
Period. End of
That's it.
discussion. They're either going to put 5%.
And yours is not that?
They're
You're
gonna
saying,
put
y'all saying that's
2.5%.
different?
We don't have a
And so-
percentage like a 2.5 on
But the
top. We
commission-
only get commission.
Your commission is what?
I think it's the same.
Hey,
It's going to be 2.5%, about whatever the insurance company says they need from you to provide the services you're purchasing.
Which is around.
And that is what?
No,
I think,
I'm sorry.
just
No,
because
I'm sorry.
no, it's going,
So, and let me just stop right here, hang on just a minute. So that's and I'm gonna say this as broker's fees, okay, whatever that is, I'm gonna say that's a lot of money involved, okay? And everybody looks at this county and says, they got $30 million. You know, well, it takes $30 million and $100 to run this blame county. And we're so far behind in many other aspects that people don't see. And yeah, I kinda get a little aggravated, I'm not gonna lie to you. But at the same time, I want something cheap. I want something great that's cheap for the employees of this county. That's what I want. Can anybody offer that?
Absolutely.
don't get cheap
Everybody
insurance.
can. No, I don't want cheap insurance. I want something, I want good insurance, cheap, for the employees of this county. And I want them to understand and feel like they're respected now as employees instead of just something dumped in their lap. That's what I want. And if anybody else has anything different, that's fine, but that's what I'm looking for. I don't want to pay $200,000 in commissions and fees and stuff like that. If you want our business, what can you offer us to get good coverage for our employees at a decent price?
If I
Yes,
may say
and
one more
please be
thing,
quick, because
maybe it'll take
we're
it
45
clear.
minutes.
If we went to any insurance company who gave you a quote, a proposal from a broker, and you told them to remove the broker fee,
Mhm.
your all's current rates would drop by 5%.
Okay,
Okay,
So
I
we-
can't get any clearer.
pardon me?
4.76.
Okay,
Okay, they're gonna drop. If we are the broker on your case, and you're paying me 2.5%, and you said we don't wanna pay the broker anything at all, they would
Mhm.
drop 2.5%. If you tell me that we just want you to let the insurance company assign whatever they think is fair to pay me, that insurance company is gonna pay me typically somewhere between 3 to 6%. And you don't get a say in it.
okay.
So I know that we have
Is everybody in agreement with that?
a fair fee.
No.
But the insurance company,
No,
the
you
insurance
always,
companies,
You always
No.
have.
I think we need to move to qualifications, like brokers. And this.
Yeah.
Hey,
You're gonna go-
stay up there.
Hang on a second.
I think we have a question.
I'm sorry, Commissioner.
May I ask?
I just wanted to ask you, with any of the employees, I think I asked Kevin this, but with any of the employees having a pre-existing condition, if we chose you, are they gonna be able to continue on track just like nothing ever happened, or is there gonna be any kind of glitches causing families problems?
No, there's not. The federal law states that pre-existing conditions were eliminated through the Affordable Care Act that was passed in 2013. And so when we change insurance plans, or if you do change your insurance plan, there are no pre-existing conditions applied to anybody.
Okay, thank you.
You're welcome.
So I'm just curious, and let's just say we go by our current, we'll round this number to 2.5, okay? I think that's a halfway round number, okay? Can anybody come up here based off on 2.5 that we pay for our insurance right now and tell me what the bottom line fee is on that particular insurance? Can anybody tell me that?
Anything you want.
On what the broker fee?
Whatever you,
I mean, whatever the,
And it's different for each product
It
too.
is.
That's the
Yeah.
thing.
Because-
Y'all are asking questions that really, you can get a multitude of answers from.
Okay.
Because it depends on the product.
so let's go to qualifications then. And you
But-
brought that up. Yes, ma'am.
I just want to say, and I'm sorry, but I have to do this because I'm your broker right now, and I feel like that you need to know this, and everybody else needs to consider this. I personally feel like that you're making a big mistake with a 4-year contract, choosing a broker for 4 years. I think that you should let everybody bring in their
no.
Okay,
You can
Ms.
do it.
Dawes told me it could be 3, right, Ms. Dawes, at
It could only
3,
be
or
3.
we could
It
cancel
could only be
anytime.
for the balance of your, this term that we're under is James Inslee the second. It's a 4-year term, but we're already into it. It can be up to December 31st of your current term, but it has to contain a provision, just like our trash, that it can end upon X number of days' notice to either party. So
Okay.
you don't have to have a multiple year
So we can
contract,
cancel that
but
at any
you
given
can.
time.
And that is
Within that.
fair, but I think you should actually, like you do now, look at everybody's proposal, choose what's best for you.
Can I say this about commissions real quick?
Sure.
The way our brokerage handles commissions is, and we've been truthful about this, we take whatever the default is, okay? The reason we look at commissions is when we get a proposal like we've gotten, a 28% rate increase, right? And we go to the carrier and say, listen, this is the bottom line that the group will take. The carrier will come back and say, look, this is as low as we can go, but we're gonna need you to come off X number of percent to help us get there. So the only time we start considering those commissions is in terms of going down, right? To help you get to the number that you want to get to. But we don't ever increase our percentage. We don't ever write into the contract. So it is incorrect to say that there's a commission percentage out there that you guys just have to live with, because that is part of the contract. So when we give the proposal to you with the rates that you have right now with United Healthcare, our commissions are built into that. If you come back to us and you say that's not acceptable, then we've got a decision to make. Either as a brokerage, we're gonna come off commissions to help you get where you wanna get to, or we're just gonna say we don't wanna do business with you. But to say that you guys are gonna have to live with whatever we take as commissions is not a correct statement. You as the county always have a choice and what you're going to agree with on our commission schedule. You always have that choice, okay?
Correct.
Agree.
Negotiate on the table, man.
Agree with that.
28% was opposed to.
I'm sorry?
I said negotiation going on the table, and 28% was presented to us that this was going to be the hike that we were facing for our employees.
No.
So I would think that if I had your business, as large as the county is, it's one of the largest employers, I would have been trying to say, hey, I'm not going to go up this much, and 28% for Fannin County to here is a lot of daggone money, I think.
That's not gonna happen, Commissioner.
Yeah,
And it
not
ain't
gonna
gonna happen.
Yes, Commissioner, by law, we have to present to you the renewal that the carrier provides. So
Well, why would
before,
you pick 28%?
we did not.
We did.
No, that the carrier actually raised your rates 28%, and we have to, by law, present that renewal to you, and then at that point, that begins our negotiations to find you
Okay.
something better.
And there are other
You're
carriers.
supposed to find us the best deal for our employees, right?
And we're
Yes,
doing that,
sir.
yes, sir, we're doing
We're
that
in the
currently.
process of doing that now.
Thank you.
Same thing, Mr. Fannin?
Absolutely.
Okay. Same thing, Mr. Bidwell? Have you been listening to anything that's said right there? Just hang on.
I was not tuned into, what am I asking to?
Well, that's, we need to be tuned in because we're all
Well,
asking the same
I
thing.
didn't, I kind of got lost on
Well,
what was being said. Because if I got a 28.5% renewal, I could sit there and tell the carrier, if I was getting paid five, I wanted to reduce it to 2.5, and they would change the renewal to 26. If I told them I didn't want any commission, they would reduce that renewal from 28.5 to 23.5, and you'd pay me a fee.
You got the wrong
And
number.
there's no,
And nobody can work for free either, let's just be clear.
no, they can't. That's why we're charging 2.5. We gotta get paid.
And that's on top of what United Health would pay you, is that
No,
correct?
no,
Okay.
absolutely
Well,
not.
and ma'am, I know you're getting aggravated with
Oh,
me.
I'm
but,
not aggravated, I
you know,
just don't
I'm
want
just
you to
saying-
think he's saying
No,
exactly.
Absolutely
I'm trying to
not.
figure all this stuff out. That's what I'm trying
Absolutely
to
not.
do.
I would
So-
say this, I would say this to the board, to make it crystal clear.
Yes.
We could tell the insurance company that we do not want any broker fee put in at all, period,
Pay
in
you just
discussion.
that commission.
And then we
Correct.
would negotiate you all paying us a fee every month.
Okay.
Would that fee be 2.5%?
Hey, you said would that fee be 2.5%?
That is correct.
Okay.
That is correct.
Lord have mercy. I feel like I need a cigarette and I don't smoke.
We're gonna charge you.
Well, I think it would just be, get into the presentations of qualification
Alright.
of brokers, because y'all are asking a lot of questions that can
It's a
be
wide-
all over the
wide
board.
array.
You gotta have, you're gonna have to have trust in your broker.
Once we bring you, whoever brings you the quotes, you guys will be told up front what the commission is, as Marvin said earlier, and if you
And it's
guys
disclosed.
are not happy with that, then it's perfectly up for negotiations. But you'll see that going in. It's not gonna be.
Another crazy question, just because I don't know, all right? Has the government, I understand with COVID, there's gonna be an increase here and there. I understand that probably, that's a probability. But why is there such, the potential of such a huge increase? And is it from previous claims?
Previous
Because
claims.
Previous
we-
claims, if you-
And is that taken into account that maybe some of those claims are not coming back?
May I disclose information that we talked about as far as the claims? I mean, I'm not gonna.
And it's just,
The claims were way above what, but they were, as I explained to you in our meeting, they're coming down.
yeah.
And they're coming down, I think, because the group is starting, we have actually helped some of the employees go other places to find coverage to keep your premiums down. That's something that we do by personal contact, is we know what's going on in this county. We know who's sick, we know who's not.
Okay.
And we try our best to keep an eye on you guys over the course of the year, to see if there's something we can do to offset those losses to the county and keep your rates down.
All right.
We do that for all our groups.
And you've
So-
had less than a year as far as premium versus claim.
With United Healthcare, you got 7 months.
Take a little 10-minute presentation for all of them, just do it. If you would, all right, I know we run out of time.
Let me just,
Yeah,
can
go
I just
ahead.
say something real quick? I do have a concern, and I've had it ever since the beginning, that maybe Cynthia said, because we're doing away with the competition aspect. And Kevin said a minute ago, we've got to have trust in our broker. Well, if we do it this way, we're going to have a lot of trust in our broker.
You will.
That's right.
If Kevin knows that he's the man, then he's, got a little leeway. But if he knows that he's got to beat Ron and he's got to beat Matt, then the competition, is tighter. If everybody compares and, the bottom line is the price. Now, we got to look at other things. To me, we got to look at three things. We got to look at price, we got to look at customer service, that Matt said, and it was a good point about customer service. And we've got to look at, what was the other thing?
Your plans.
The coverage. what value we got. And all that's packed into one thing, value, okay? Customer service, coverage, and price. That's what our people want. So, you know, I'm kind of, the process I'm kind of leery on, because the competitive factor isn't there when we choose one person. Am I missing something? I mean, Chairman, do you understand what I'm saying?
I do.
Matt?
And I'll tell you what, Matt, while you're up here, let's just do this, if it's all right with y'all.
Definitely.
Give us 10 minutes, and we're gonna cover 10 minutes
Sure.
of, no, you come up here and tell us in 10 minutes why we should go with MSI.
That's probably a great idea.
Yeah,
Thank
let's
you
just do
so
that.
much. We're applying for this as a broker RFP, which means I can be paid off of the commissions. I also have a consulting license, and I think what people look for is you look for somebody who, if you tell me to go out and get you a red 67 Chevrolet or something, you're gonna go out and find it, and that's what it is, and you're gonna do it.
Right.
But what you look for in a consultant is someone who's going to advise you in terms of, maybe you're not articulating what you are trying to do, but we're going to try to guide you in a path that is good for both you and the employees. And that's part of what I do. I wanted to address the fact, you know, why are we just using one broker? I'm going to get, well, remember this, it was always said that insurance companies are only going to release a proposal based on the best information they have. And so like if right now in this market, there's only about 4 or 5 carriers. You got Aetna, Cigna, United, you got Anthem, Humana is a weak carrier up here. So you got those 5 carriers. All of them are going to get the same census data. All are going to get the same claims data. Now what happens on a consulting side, I'm going to look at your high cost members, and I'm going to be asking all the questions that I can to HR, because we try to take, they're going to see something in there about maybe an employee who has an ongoing large claim, and it's my job to sell it to the insurance company on why that's a good risk and why they need to lower their cost. So if I sit there and I use every trick I know in the book to get them to lower that rate, that insurance company is going to lower the rate, and they're going to release it to anybody who gave them a census data. So consultants like me who sit there and work to pull your costs down, I'm just working for the other guy. Because ultimately, what's going to make the difference when you get the proposal is what's the fee the consultant's going to charge. That's what's going to make the difference. And so, you know, our fee isn't the lowest out there. It's not the highest. It might be in this particular setting, but that is the fee that we need to give you the services that you need to service your employees. You got to have good communication pieces. You got to have people to talk to them. Everybody in our staff is a licensed agent. When we bring up people to see your employees, none of them are paid commission. Every one of them is paid a salary, because we don't want them up here trying to sell the employee an insurance product. We want them to look at them like you're talking to your brother, or you're talking to your son, or you're talking to somebody who you want to give them good advice. And so our whole culture has been built upon giving our groups good advice. And we were out here almost 15 years or longer, and I think that there's a lot of people here from many years ago, they saw that in this year after year. And the old saying is, you know, don't do something right when everybody's looking, but you're supposed to do the right thing all the time. And we built a culture of doing that. And we do the right thing all the time. We've got over 60 governments that we handle insurance for. And the reality of it is, we know that when an increase hits, it's very significant to our local governments. And a lot of times, the employees can't bear it, and we know that the governments are really struggling to find the money to cover them. So we put a lot of thought and put a lot of effort into making sure that we're taking care of you guys the best we can. And so I don't need 10 minutes to tell you that. I just really tell you that from a heartfelt position, we really think that, you know, it's a great responsibility to have all your employees' personal information, to trust us to get the best rate, and to trust us to deliver your message to those employees, and we take it to heart. And so we hope that, you know, y'all will agree with us. But God bless you. Thank you. Thank you.
Can we, as incumbents, go last?
Sure.
We're going?
Yeah.
I'm going to introduce Skip Hill and actually Karen Willis. They're with Partners Benefit Group. Partners Benefit Group is an affiliate of my agency here at Kevin Payne Insurance. As y'all know, guys, I'm local. I know everybody here. I was previously had the county health insurance with under a term with the previous administration. But what I can't stress enough is we're here local. When we took over the account last time, we had employees that would come to our office that loved that because they were intimidated by the technology and they loved being able to talk face to face. I have 16 employees here that are all licensed in Blue Ridge. Unfortunately, Gerald had to leave, and we're here day in and day out. I know these people, and I have many of them already insured with other stuff. But I just want to stress to you that I'm not going to do anything to make my name bad because everybody in our community is a customer of mine. So if it goes bad for Fannin County, guess who else it goes bad for? It goes bad for Kevin Painter Insurance. And look, I've got way more opportunities outside of it than I do within Fannin County. So I do not want this little small segment, and it's a big segment, don't get me wrong, but I don't want this to make my whole agency look bad. So that's the trust that you've got in dealing with someone local. One of the big advantages is, like I said, is the employees, they know us and they're going to come. The expertise that I bring with Partners Benefit Group, I had them in here with me last time when we did it, and just to a point, we came in $300,000 less than the previous renewal was. We kept it flat when we came in. Our second renewal before we were ousted by the other commissioner was only $68,000, I believe. It wasn't, but in their defense, it all depends on health. And it will be a work in progress for us to work with the three commissioners, the HR, and the staff to keep that. I'm a taxpayer here in Fannin County. My employees are too. So I've got 100% buy-in to want to keep that and give you the best rate. But we will work with you to develop a plan. We have the same carriers they have, same carriers they have. There's not anything that company-wide that we're not going to be able to bring to you. We're for full disclosure from that standpoint. I just ask that, you look who's got the most at risk with this going bad, and you're looking at the guy right here who's got the most at risk to go bad if it does. Is there anything I want to add to that?
I would like to just go
Absolutely.
just a few seconds. I haven't been able to meet the HR person, but we also, service is like our key thing, and I know that was an RFP, and I encourage you to call any of our other county governments, talk to their HR, and find out what we do for them, because I would bet that they're going to tell you that we've taken so much work off of their HR department, because there is only one HR person for 250 employees. That's a lot. It's a lot. And every, when they come up with the federal government comes up with regulations, you got to do this, you got to do that, it all falls on her. And so we take that off of the group. We do that. We reconcile the bills monthly. We enroll all new hires. We would have already talked with you, went over everything with you, showed you what plans you could offer. We would enroll you just like the gentleman from MSI talked about. We put it in the system. It goes to the carriers. You don't have to fill out a bunch of forms. You don't have to go into a bunch of systems. You don't have to do any of that. We do all of that. So all you have to do is tell me that Mr. Jamie Hensley is the new chairman and he started this date, and you send me his information, and then we go from there, and then we'll send you back your deductions. So we just kind of take it from there. So I do encourage you to call our references, just because
There's
I know.
30, 40 groups.
like the public sector that y'all had asked about. So we, just to let you know that we do a lot of that service and take a lot of that work off of your staff, and because we do believe in the good old-fashioned customer service as well. So.
Thank you. Any questions?
Yeah, matter of fact, I got one, and I want to go on the record, so. Did I promise you anything going into this election?
Absolutely not. And you hadn't given me anything either.
And I'm not getting anything.
You have.
Because I did have a commissioner call me from another county and asked me if I was gonna give this to you because you may have campaigned for me before. And I
You've
wanna
not
go on
promised
record to
me a
make
single
sure
thing, but you know what?
That's not the truth.
I will say, even when we were in here before, as y'all know, I'm a volunteer firefighter. I volunteer tons of hours this county. And even when that, I was done, I still volunteered for Fannin County, never quit. And if I don't get this case, I'll still be volunteering here for Fannin County.
I just wanted to make that clear.
Very clear on record. Thank you, Commissioner. I appreciate
Thank
you
you.
doing that.
Last, and I certainly hope not least. But we appreciated the opportunity that the county has given us over the past 4 years. It's been a great learning experience for us. We've got over 120 groups. And what I might say about us is that we've had, and I told you this, and I think Glenn knows it, Commissioner Cersei may not, but we've had Union County for 40 years, and we just finished their 41st renewal today. And so they're renewing with us for another year because we were able to keep their costs down, keep their employees with a good plan. And that's what we hear from all of these other counties around here about us, is that how can you guys do in Union County and you can't do it here? And the reason for it is because it takes time. It takes time working with any group in order to go in there and try to set them up with something that works, that can bring down deductibles, get the people healthier. We can do, all of us agents can do the same thing. We can do it electronically, we can do it by paper, but we like the aspect of sitting down in front of an employee and explaining to them exactly what it is that they have, so that we hope that they can understand. And last year at open enrollment, we sent out, Jesse, just for your information, last year, we sent out those, we sent out by email and also gave to the people that attended the enrollment meetings last year. We sent out the information about the plans that we were presenting. But the reason that I think you ought to use us, and I guess all three of us has got their own opinion, but I think it's because of us, because we care. I mean, we care about your people. You're never going to find another agent that's going to care as much about your people as we do. So, next.
I'd also like to say thank you in case we walk out this door for the last time in a couple of years. We're always going to be back in here fighting. But thank you for giving us the opportunity. I think we've done an exceptional job given what we had to work with. And the orders that we were given, we carried out perfectly. I do want you to know that even though we can all quote, and believe me, I've looked up Kevin Painter, I've looked up Mr. Bidwell, I've looked at their licenses, I've looked at who they're actually contracted with. We do our research. We know what we're up against. We can all get the same quote as long as all the information is the same. As long as everything has been provided to the insurance company the same way. And since we're the incumbent, 90% of the time they're gonna call us back and say, hey, this guy tell us about this. What do you know about this? We're gonna tell them what we know about it. Where you really make the impact on the tail end is how much stuff do we do for you that you don't have to pay for, that we don't add onto your bill. How much stuff do we do for the employees that you don't have to pay for? My agency pays for that. It's in the books already. It's been provided for. How many things are we willing to do for you? How much of our commission are we willing to give up to make something work for you? But again, and Marvin has a few words, but I just want to say thank you for your consideration, and we appreciate it.
Thank you.
I guess to answer the question of, why you should continue to work with Total Insurance, I think the biggest thing that I can say is we're not a one-size-fits-all firm. In other words, we're not going to come with a blueprint of what the county should do. Again, we're going to hear your heart. We're going to hear what you want to do, and we're going to advise you in the right way to go. And I think that is the most important thing in any relationship and in communication, is that before I tell you what the answer is, I listen and find out what the problem is. And I think that's what makes our brokerage unique, is that amongst our 100+ clients, we do that. We take the time to listen in that relationship and find out what the utmost goal is. And so in saying that, we can accomplish anything that the county wants to do. We can do the technology piece, we can do any of those things that you all will want to accomplish if you understand and we understand why we're doing it and why we're moving forward in that way. When we took over Union County, one of the reasons why we do on-site enrollments is a lot of those people at that time when we took it over couldn't even read and write. All they could do was sign an X on their name. So we're not going to leave that person up to a computer enrollment or say, look, here's a link, go follow it. We're not even just going to leave them up to an email and say, hey, this paper explains your benefits. We're going to sit down and explain those benefits with each employee. And I'm going to say the last thing. I don't know what other brokers are like this, but I know these two right here that run sometimes will neglect his dinner, taking phone calls from a $13 an hour wage marker. He's not just going to wine and dine or try to look good for the commissioners. That guy that has absolutely nothing, he's going to take his phone call on his personal cell phone at any time of night that he's awake. And I think that speaks volumes. Yes, we're not here local, but you're going to get local service. Anyone who works with one of your employees, any of our enrollers, are going to give their cell phone number to that employee. That employee has a direct contact because, again, we don't want Miss Jessie, we don't want her being in the insurance business, right? We don't want her answering insurance questions. So I would say, working with Total Insurance, you can talk to any of your employees, whether they've been disgruntled, whether they've been upset, they've still had an open line of communication to be able to talk with our firm, to get a live person, not necessarily 24 hours a day, but 8 to 5, they're going to get a live person, okay? And if they can't get somebody at our office, they're going to have their agent or they're going to have Ron and Cindy's cell phone number that they can call them directly. We have people call us in the middle of the ER. We have people calling us on the way of the ER saying, hey, what do I need to do? How much is this going to cost me? And they can get us directly. And so I think that's just a huge point. No, we're not local, but we're only a phone call away. All right. Thank you all so much.
Thank you. Appreciate it.
You might point out how many groups we've lost in the last 20
Commissioner
years.
Searcy, you have anything we've heard?
No, I'm fine, I'm fine.
Okay.
I'm
Mr.
okay.
Preston?
You're fine.
Okay, I just want to thank all of you for coming in, and I apologize if we got a little out of sorts there. It is what it is. We're just trying to get the best deal we can for our employees moving forward, and I think y'all can understand that.
You're doing a good job.
In this position, that if we didn't do that, we would be negligent in that sense.
Yeah.
So we want something great for nothing.
Yeah, well, you
Like everybody else does.
You gotta keep my taxes down too. I'm paying taxes up here now.
I do appreciate everything that has been said this evening. I really do. And whoever this Board of Commissioners choose to represent us moving forward, I just appreciate each and every one of you
I do too.
for your time and effort coming up here, presenting your case before this board, and I just want to thank you. Thank you very much.
Thank y'all.
Thank you
everyone.
for having me.
Appreciate it.
Thank you.
Can I make one recommendation? I don't know when you guys are making a decision, but I think that's something that's also important is not how many county groups each of us has or public sector. I don't know and you older brokers may be able to answer this for me that have been in the business longer, but you know, we talked to a county last week that their employee rate is $3,500 for a single employee. Now, that's not something I would boast about having that group. But I think if there's a way to not only talk about what counties we have, but what those counties actually have, I think that would actually be something that would behoove the commissioners to actually individually maybe ask the brokers to provide some of that
Value.
information.
Yeah.
All right. Thank you.
What was here?
Can Marvin repeat that for us?
Well,
Can you go
Mr.
ahead?
Searcy?
Yeah. what I was saying, Commissioner, is that to have a county or to have a client is one thing, but we should also maybe provide to the commissioners what some of those counties are actually paying for their insurance. Because that goes a long way to tell us, really where you guys might be at in 3 or 4 years, should you select one of us.
Well, thank you, sir.
Thank you.
All right, nothing further, I'll make a motion that we adjourn this meeting, this work session.
Second.
All right, all in favor? All right, we're adjourned for